All right, welcome back to the deep dive. Today we're diving into something really, really fundamental, especially when we're talking about serious illness, and that is communication.
Absolutely.
And it's so much more than just like doctors giving information. It's about connecting with the individual who is, going through something incredibly difficult.
Yeah.
Their family as well.
Totally.
And if these conversations aren't handled well, or sometimes don't happen at all, it can really, really impact the patient's experience, and it can really leave them feeling powerless, which directly impacts, the difficult decisions that need to be made, how they cope with their situation, and even the grieving process for their loved ones.
And that's something that comes up over and over in the research, just how crucial good communication is in these situations.
Right.
And for this deep dive, you've pulled together a really valuable collection of resources. We've got guidelines that are specifically focused on communication in palliative care, some great research articles that really look at what works and what doesn't, and even transcripts from actual communication skills training.
Yes.
So this gives us a really comprehensive picture of this vital skill.
Exactly, yeah. So for you listening, our goal today is to dig into these sources, pull out like the key communication skills and understandings, and really provide you with some practical knowledge that you can use to navigate these types of conversations.
Absolutely.
Whether you are preparing for a specific situation, you're just trying to catch up on the best practices, or you're simply curious about this very vital aspect of healthcare.
Yeah.
We're going to be aiming for those moments where things click and make sense without overwhelming you with too much at once.
Exactly. And that was something I really appreciated about the training materials we looked at. They break things down into really manageable steps.
Right.
Which can feel less daunting when you're trying to apply these skills in real-life situations.
So, where do we begin to unpack all of this?
Well, I think we have to start with the bedrock of good communication, core communication skills.
Right.
This came up again and again in all of our sources, the importance of these foundational techniques.
Yeah.
And the first, and maybe the most crucial, is active listening. And it's more involved than just waiting for your turn to speak, isn't it?
It really is.
It's not just about hearing the words.
Yeah, it's about one of the documents stress that active listening means not only paying attention to the words that are being spoken, but also to what's not being said.
Oh, that's interesting.
You're tuning into their body language. Like, does it align with their words?
Right.
What emotions might be hiding beneath the surface?
Yeah, picking up on those subtle cues.
Exactly, yeah.
Yeah.
And something that might seem counterintuitive but is so important is allowing silence.
Oh, tell me more about that.
Well, we often feel this need to jump in and fill any quiet space.
Right.
But that pause can actually give the person time to process what's been said, to really let it sink in.
What's fascinating to me is that silence can hold so much power in these sensitive conversations.
Yeah.
It creates space for reflection, for the full emotional weight of what's been discussed to register. And, our training materials even pointed out that practitioners need to be aware of their own discomfort with silence and resist the urge to sort of jump in and interrupt that process.
Interesting.
Because it's often in those quiet moments that a patient might gather their thoughts to ask a really crucial question or reveal a fear that they've been holding back.
That makes a lot of sense.
Yeah.
So beyond just hearing, you're talking about truly absorbing what's being communicated both verbally and non-verbally, and then giving the space for processing.
Exactly.
Wow. So now, moving on from listening, the way we formulate our questions is absolutely critical.
Yeah.
And the sources make this really clear distinction between closed questions, which are useful for getting specific facts, like a yes or no answer. But they can really limit the conversation.
Yeah.
And if you ask too many of those in a row, it can feel like an interrogation.
Right. Like you're just checking boxes rather than having a conversation.
Totally. Yeah.
Yeah.
And that's where open-ended questions become so valuable.
Yes.
These are the ones that typically start with, how, where, when, or, tell me about.
Right.
And they encourage the other person to really explore their thoughts, feelings, experiences in their own words.
It shifts the dynamic from like a one-way question and answer to a much more collaborative, insightful conversation.
Absolutely. And we even saw some really helpful examples of how you can shift from a closed question to an open one.
Yeah.
So instead of saying, "Are you in pain?" A more open approach would be, "What are your thoughts about your pain?"
That's a great example.
And that small change can lead to a much, much richer understanding of what the person's experiencing.
Absolutely. And to make sure we're really grasping what's being shared, the techniques of reflection, which include paraphrasing and summarizing, are invaluable.
Yeah.
Paraphrasing is essentially restating what you've heard in your own words
Right.
to check if you've understood correctly.
Right.
And summarizing is pulling together the main points to confirm overall understanding and to identify any gaps,
Yeah.
anything that might be missing or unclear.
So it's like saying, so if I'm understanding correctly, you're saying, or, just to make sure we're on the same page, the key things we've talked about are.
Exactly.
And then it gives the other person a chance to say, yes, that's right. Or actually, I meant this.
Right.
It's a great way to avoid misunderstandings.
Absolutely. And building on this foundation of asking and understanding, there's this ask and tell approach, which our sources really emphasized
Right.
as a fundamental shift towards true partnership in communication.
Yeah.
Could you explain how that works for our listener?
Yeah. So instead of just diving in with a whole load of information, which can be really overwhelming, ask and tell has 3 key steps. First, you ask the person what they already know about the situation, and crucially, what they want to know,
Yeah.
which respects their autonomy and their readiness for information.
Absolutely.
Then, and only then, you tell them that information in a way that's easy to understand.
Right.
And finally, you circle back and ask if they've understood what you've said and if they have any further questions. So it's tailoring that information to their specific needs and level of understanding.
It's so interesting how ask and tell directly addresses a common pitfall, which is providing too much information too soon.
Yeah.
By understanding what the patient knows and wants to know, we avoid overwhelming them. And we make sure the information is relevant and timely for them.
Totally.
And this approach really empowers the individual to kind of guide the flow of information according to their needs and coping style.
That's a great point. Now, one of the really insightful areas that came up is how to respond to emotions. And that's where the NRSC mnemonic comes in.
Yeah.
And this seems so vital because, as the sources point out, if you don't acknowledge and address the emotions that are present, the conversation can get really stuck.
Absolutely. And ignoring someone's emotional state can be a huge barrier to communication.
Right.
It can actually impact how well they're able to process information. Research suggests that the more attuned we are to these emotional cues, the better the patient's recall
Interesting.
of important information.
So let's break down this NRSC mnemonic. What does the N stand for?
The N stands for naming the emotion. So you're identifying the emotion you're observing, maybe through their tone of voice, body language,
Right.
or what they've said, and you're gently suggesting it back to them, but without telling them what they feel.
So you're not saying, like, you are angry.
Right, exactly. Or
Say-
like, you seem, I wonder if you're feeling worried about this.
Yeah,
It seems like you might be feeling a bit sad right now.
Right.
Just opening up that space.
Got it. And then the you.
U is for understanding, showing that you appreciate the difficulty of their situation, that their feelings are a natural response.
Yeah.
You're acknowledging their emotions, make sense?
Okay.
But without claiming that you know exactly how they feel.
Right.
So it's something like, given everything you've been told, I can certainly understand that you are worried.
That makes sense.
Yeah.
And then we have R.
R is for respecting. This is your opportunity to express genuine admiration for their efforts, their strength, their resilience.
Yeah.
A statement like, I can see how incredibly hard you've been working to stay positive through all of this.
Yeah. Yeah. That is powerful.
Yeah.
Okay. S.
S is for supporting. This is where you offer your support and
Yeah.
emphasize that you're in this together. How can we best support you right now?
Okay.
Shows you're on their side.
Yeah. And E.
E is for exploring, inviting them to share more. Could you tell me a little more about what you are feeling right now?
Sure.
With a simple, open invitation.
Yeah. Wow. So what's crucial to remember is that NRIC is about demonstrating empathy.
Yes.
It's about acknowledging their experience without judgment and providing a safe space.
Exactly. When people feel heard and understood on that emotional level, they're often better able to engage with the other aspects of the conversation.
Now, of course, communication in these situations isn't just with adults.
Right.
The sources dedicate a lot of attention to communicating with children.
Yeah.
And it's really clear that this requires a very different and sensitive approach.
It does. And one of the fundamental points is that children communicate in so many ways,
Yeah.
not just through spoken language, but through their body language, and especially for younger children, through play.
Yes.
So to connect with them effectively, you need to be attuned to all three of these channels.
So starting with body language, the sources emphasize how incredibly perceptive children are, even young ones.
It's amazing how much they pick up on. Those subtle cues.
Okay.
Your facial expressions, your posture, whether you seem rushed or calm. It's so important to be mindful of our own nonverbal communication.
It really is, right? So to make yourself as non-threatening as possible.
Yeah.
Get down to their level. Maintain gentle eye contact if they're comfortable with it.
And at the same time, observing their body language. Are they withdrawn? Are they fidgety? Are they making eye contact?
Yeah.
These nonverbal signals can tell you so much.
Absolutely. And then there's play language.
Mm-hmm.
For many children, especially younger ones, play is how they understand or process the world.
Right.
Including difficult experiences.
This is their language.
Yeah, it is. It really is.
Yeah.
So these sources suggest, being prepared. Have crayons and paper, dolls, or other simple play materials, and be willing to join them in their play, letting them lead.
It's about entering their world, using play as a bridge to build rapport and understand what they might be struggling with without putting pressure on them to talk. Their play can reveal their fears, their questions, in a way that direct questioning might not.
That's such a good point. And when it comes to spoken language with children, the key themes that emerged from the sources are appropriateness, honesty, and simplicity.
Yeah, those are crucial. Avoiding medical jargon, not talking down to them, and using language that matches their developmental level.
Right.
It's about respecting them as individuals.
Totally. The sources also highlight some common barriers to communication.
Oh, right. Like what?
Appearing judgmental.
Oh, yeah.
Interrupting them when they're trying to express themselves, or most damagingly, not keeping promises.
That can really erode trust.
It really can. And answering those difficult questions the kids ask,
Yeah.
it requires such a thoughtful approach. One recommendation that stood out was to answer a child's question with another question.
Oh, interesting.
To understand what they're really asking. So the classic, where do I come from?
Right.
It's not necessarily about biology, but maybe about belonging or security.
Right.
So by asking, what makes you ask that?
Mm.
You can get to the heart of it.
And it shows you're really listening and trying to understand their perspective.
Exactly.
That's not just a quick answer.
There's also a real emphasis on respecting the child's space.
Oh, absolutely.
Always asking permission before any physical touch.
Yes, that's essential, especially in the situations where they may feel like they have very little control. Reinforcing their autonomy is huge.
Yeah. Okay, let's move on to one of the most delicate and challenging aspects of serious illness care. Breaking bad news. And the sources are very clear. How this is handled can have a lasting impact.
Absolutely. When bad news is delivered well, it can actually enhance coping.
Really?
Yeah. But poor delivery can have a lot of negative consequences. It can affect their psychological functioning, their grieving process.
It's almost like setting the stage for how they're going to move forward.
It really is. And the setting for this conversation is so important. As much privacy as possible, maintaining appropriate physical distance.
That makes sense.
Creating that sense of respect and support.
So the sources actually outline a step-by-step process for doing this well.
Oh, that's hopeful.
It starts with figuring out what the patient or family already knows, using open-ended questions.
Right. Meet them where they are.
Exactly.
Yeah.
And then gauge their perception of how serious they think things are. They might have an idea.
Yeah, they might have an inkling.
And then we see the ASAC and tell approach again.
Right.
Explicitly getting their permission before sharing the information. Letting them know you have something serious to discuss.
Just to prepare them?
Yeah, exactly. And for delivering the information itself, there's the WPC method.
WPC. Okay.
Warn, pause, check.
Okay, break that down for me.
So you give a brief warning that bad news is coming. You pause to let it sink in. And you check for understanding. Break it down into smaller chunks.
Right, so you're not just hitting them with everything at once.
Exactly, yeah. So, for example, instead of saying terminal cancer, you could break it down first, you have an illness, pause, the illness is serious, pause again. And then finally, it is serious enough to eventually be life-limiting.
Right.
So, you're gradually introducing the information.
That makes so much sense.
And throughout this, responding to their emotional reactions with empathy.
Of course, yes. Nurse.
Exactly, nurses. It's crucial.
Crucial.
Yeah. Um, and of course, you need to summarize what's been shared and make a plan for next steps.
Yeah.
Make sure they know how to reach out for more support and that you're available for questions.
Absolutely. And the sources caution against minimizing their experience.
Hmm.
Saying things like, it could be worse.
Yeah.
Or expressing your own overly pessimistic opinions.
Right. It's about allowing them to express their emotions.
Exactly.
Yeah. Okay, now, as a serious illness progresses, communication shifts towards discussing goals of care. And the sources emphasize these conversations should be centered on the patient's values and what matters most to them.
That makes sense. Their life aims, their values, what's important to them.
Yeah.
And the research shows that these discussions have so many benefits.
Oh, really? Like what?
Well, they can lead to improved quality of life, a reduction in those medical interventions that might not be helpful or wanted,
Interesting.
care that's more aligned with what the patient actually wants, more positive outcomes for families,
Wow.
even a reduction in healthcare costs.
And it's interesting, a lot of people worry that these conversations will make people more distressed, but the evidence doesn't support that.
No, in fact, it often shows the opposite. When patients feel heard, their wishes are known, it can reduce anxiety and improve their sense of control.
Wow.
Yeah.
So what are the key elements of discussing goals of care?
Well, sensitively sharing information about their prognosis, but being mindful of how much they want to know at any given time, finding out their preferences for decision-making,
Right.
exploring their fears and hopes, their goals, understanding their views on trade-offs, like what level of impaired function would be unacceptable to them, and their wishes for family involvement.
That's a lot to cover.
It is. But there are tools to help. The wish.worry or hope.worry framework is a really helpful approach for sharing prognostic information.
Okay. How does that work?
It's about acknowledging both the patient's hopes for the future
Right.
and the potential worries based on their situation.
So it's like being honest, but not eliminating hope.
Exactly. It's a balancing act.
And it's important to remember everyone copes with this information in their own way, at their own pace.
Oh, absolutely. They might go back and forth between accepting the reality and moments of denial or hope.
Right.
That's what's called middle knowledge. Clinicians need to be patient and understanding of that variability.
Okay, so how do we actually have these conversations? Are there any specific tools?
Yes, there's one called the Serious Illness Conversation Guide. It's a structured tool that helps facilitate these discussions.
What's included in that?
Well, there are steps like assessing the patient's understanding, sharing the prognosis, using that wish-hope.worry approach, exploring their goals, fears, strengths, acceptable trade-offs, and then concluding with a summary and plan.
It sounds very comprehensive.
It is. It helps to ensure you're covering all the important bases.
Okay, so beyond this guide, are there any specific situations that might signal the need to start these conversations?
Yes, the sources actually give some guidance on that. They talk about triggers based on the disease,
Okay.
like advanced cancers, COPD, congestive heart failure, end-stage renal disease. Also, advanced age and increasing frailty.
It's like knowing when those conversations become even more crucial.
Right. And of course, documenting these conversations and the patient's goals of care in their medical record is essential.
Yes, of course. So everyone's on the same page.
Exactly. It ensures their wishes are known and respected.
So on the topic of goals of care, did the sources mention anything about costs? I know that's a big concern for a lot of people.
They did. It's worth noting that studies have shown a potential for cost reduction with these early discussions.
Oh, interesting.
Yeah. And with the integration of palliative care in general.
How so?
Well, patients who have these conversations often have lower healthcare costs and spend less time in the hospital, especially at the end of life, because their care is aligned with their wishes and less likely to involve aggressive interventions they don't want.
That's really significant.
It is. It highlights the value of these conversations, both for the individual and for the healthcare system as a whole.
Absolutely. So another concept we should discuss is cultivating prognostic awareness.
Yes, that's an important one. It's the process of helping patients understand the likely course of their illness,
Okay.
but doing it in a way that's sensitive to their emotional state and their capacity to process information.
Right. So it's not just like, giving them a textbook definition.
Exactly. It's a gradual process.
Okay. So how does this work in practice?
Well, it starts with The clinician having a clear and accurate understanding of the prognosis.
Right. That makes sense.
And then a crucial step is to assess the patient's current level of understanding, just asking open-ended questions.
Like, what do you know about your illness?
Exactly. And it's important to remember that a patient's ability to absorb and remember this information can vary a lot. Their emotional state, their cognitive function, how ready they are to hear it. All of those things can impact how much they take in.
Yeah, that makes sense.
And like we talked about earlier, middle knowledge is often a normal coping mechanism.
Right.
They might remember some things, forget others, go back and forth between acceptance and denial. It's a process.
So how do clinicians actually approach this?
Well, the sources outline a stepwise approach.
Okay.
It starts with determining the prognosis, assessing the patient's understanding, inviting a discussion about hopes and fears, and then providing space to grieve any hopes that may not be attainable.
Wow, it sounds really delicate.
It is, and it's crucial to assess the patient's readiness for these discussions.
So how do you know if someone's ready?
Well, someone who insists they are fine and downplays concerns might not be ready.
Right. It's not about forcing the conversation.
Exactly. Using open-ended questions to gauge their worry can help. Like, what are your biggest concerns about your health right now?
Okay. And what about patients who are resistant?
For those who are ambivalent or resistant, there's the strategy of naming the dilemma.
Okay, what's that?
It's about gently pointing out the discrepancy between their perception and the reality.
Right. So, like, I hear you saying you're doing well, but the tests show.
Yeah, something like that, but done in a non-confrontational way.
Okay. And throughout this whole process, it's vital to link treatment options to the patient's goals.
Absolutely. So, for example, explaining how a more aggressive treatment might give more time, but acknowledging the potential for side effects that could impact quality of life.
So, about having those honest conversations about the trade-offs.
Exactly. And it's all about empowering the patient to make informed decisions that align with what's most important to them.
Absolutely. And all of these specific techniques and approaches are built on a foundation of patient-centered communication.
Yeah.
Which are really like the ethical and practical guidelines for these interactions.
Absolutely. Patient-centered communication is about putting the patient at the heart of everything.
Right.
So it often starts with simple introductions. Building rapport, maybe asking about their family, just to make it more personal.
Okay.
And then starting the conversation with open-ended questions to understand the patient's agenda.
Like, how can I help you today?
Exactly. It puts their concerns front and center.
Yeah.
And the sources really emphasized not interrupting.
Oh, yeah, that's so important.
Especially early on when they're sharing your story.
Yeah, let them tell their story.
And really focus on active listening, paying attention to both their words and their nonverbal cues.
Right. It's about showing them you're truly present and listening.
Exactly. And then eliciting the patient's perspective, their feelings, ideas, concerns, expectations, understanding what their illness means to them.
Right, because everyone experiences illness so differently.
Exactly. And, of course, expressing empathy.
Yeah.
Using that NRSC framework we talked about and summarizing throughout to make sure you're both on the same page.
Right, so there are no misunderstandings.
Exactly. And when you're providing information, use that ask, tell, ask technique.
Right, right.
It makes the information more digestible and ensures they understand.
So ultimately, it's about involving patients in decision-making.
Yes.
Discussing treatment options, benefits, risks, the option of no treatment.
And respecting their beliefs, values, and expectations.
Yeah, that's key. But putting all this into practice isn't always easy.
Right. There are challenges. Time pressure, lack of private space, language barriers can be a real hurdle.
Yeah, one of the training participants talked about struggling to communicate through a translator.
Mm-hmm. Right, and having to really prioritize what information is most essential when time is limited.
That's tough.
It is.
Yeah.
And developing these skills takes time and practice.
Right.
It might feel awkward at first, but with effort, it becomes more natural.
Yeah, and one suggestion was recording conversations, with permission, of course.
Right, for self-reflection and improvement.
Just to see how you're doing.
Exactly.
And even experienced practitioners acknowledge that this is an area of continuous learning.
Yeah, it's not a one-and-done thing.
Yeah.
It's an ongoing process that requires ongoing attention and commitment.
So as we wrap up this deep dive into communication, it's clear this is about more than just techniques.
It's a fundamental aspect of good care.
Yes, it really is.
Yeah.
Supporting patients and families through incredibly difficult times.
And these skills aren't innate. They require continuous learning, practice, and self-reflection.
And on that note, here's a final thought for you to consider. Think about one technique we've discussed. Maybe it's active listening, the ask and tell method, or responding to emotions. And try to consciously apply it in your next significant interaction.
Yeah, whether it's in a healthcare setting or in your personal life, just notice the impact it has.
Right. How might a more intentional approach to communication change your understanding and connection?
And we encourage you to delve deeper into the resources we've discussed today or explore other topics that interest you.
Absolutely. There's always more to learn about connecting with and supporting others.
Through the power of effective communication.
Through communication.
Yeah.
Well, thanks for joining us for this deep dive.
Thank you.
And we look forward to having you back for our next episode.